This is The Rounds Table.
Welcome back, Rounds Table listeners. This is John Fralick, one of your hosts. Today, we're going to do a solo rapid fire episode, so why don't we dive right in? First and only up, I guess, phase 3 trial of semaglutide in metabolic dysfunction-associated steatohepatitis. This was published in New England Journal of Medicine, April 30th, 2025 by Sanyal et al. So what was the research question here? Well, they wanted to know what the efficacy was of once-weekly semaglutide versus placebo for patients with MASH. Now, why does this matter? We've talked about MASH before, but metabolic dysfunction-associated steatohepatitis, the ARDS formerly known as NASH, puts patients at risk for progression to cirrhosis, which is associated with all kinds of complications, including mortality. Recently, resmetirom, which is a thyroid hormone receptor beta agonist, received accelerated approval from the FDA for MASH with stage 2 or 3 fibrosis. But aside from this, we really lack other medications to treat MASH. Semaglutide has been shown in phase 2 trials to significantly improve steatohepatitis without worsening of fibrosis, and this study reports the interim efficacy of the first 800 patients who completed 72 weeks of once-weekly semaglutide versus placebo. So how was this study done? Well, this was a phase 3 industry-funded, placebo-controlled, double-blinded, multi-center randomized controlled trial at 253 sites in 37 countries. This was a planned interim analysis focusing in on histological events, and there is a plan to report on clinical outcomes when the trial ends. So for the patient population, these were adults 18 years of age and older with histologically confirmed steatohepatitis and liver fibrosis of stage 2 or 3, and a non-alcoholic fatty liver disease activity score of 4 or more. There were a number of key exclusions, including if you had chronic liver disease from some other etiology, as well if patients were drinking alcohol of more than 20 grams per day for women or 30 grams per day for men, if they had a MELD score of greater than 12 points at screening, if their AST or ALT were greater than 5 times the upper limit of normal, if the GFR was less than 30, if patients had an A1C of greater than 9.5%, if they had a history of pancreatitis, and if they had been using any GLP-1 agonist in the 90 days before screening. So for the intervention, patients were randomized 2-to-1 to once-weekly subcutaneous semaglutide or placebo, in addition to standard of care. Randomization was stratified by presence or absence of type 2 diabetes, fibrosis stage 2 versus 3, and by region. The starting dose was 0.25 milligrams once weekly, and this increased every 4 weeks to a target dose of 2.4 milligrams. All patients had to have undergone a liver biopsy at screening, and then another was done at week 72 after randomization to assess treatment effect, unless the patient had a confirmed liver-related clinical event before week 72. So for the outcomes, for part 1, which is the focus of this study, the primary endpoints were resolution of steatohepatitis with no worsening liver fibrosis and a reduction in liver fibrosis with no worsening of steatohepatitis. This was assessed by one of 3 expert pairs of pathologists, and if there was disagreement, then a consensus meeting was called. If consensus could not be reached, then a third pathologist independently assessed. There were a number of other secondary endpoints, including key adverse safety events, and then this was an intention to treat analysis. So what did the patients look like? Well, from May 2021 to April 2023, 1,197 patients were randomized. This study reports on the first 800 patients. The average age was 56, the mean BMI was 34.6. The majority of patients were white at 67%, and 57% were female. 56% of patients had type 2 diabetes. At the time of enrollment, 31% had stage 2 fibrosis, and 69% had stage 3 fibrosis. So what did they find? Well, as a reminder, the primary endpoint for part 1 of this trial was actually kind of 2 components. The first being histologic resolution of steatohepatitis with no worsening liver fibrosis, and the other was reduction in liver fibrosis with no worsening steatohepatitis, as confirmed on liver biopsy done at 72 weeks. So for resolution of steatohepatitis with no worsening liver fibrosis, this occurred in 62.9% of patients in the semaglutide group, compared with 34.3% of patients in the placebo group. That was a statistically significant difference of just over 28%, with confidence intervals ranging from 21.1 to 36.2. For a reduction in liver fibrosis with no worsening steatohepatitis, this occurred in 36.8% of patients in the semaglutide group, compared with 22.4% of patients in the placebo group. Also a statistically significant difference, this time of 14.4%, with confidence intervals ranging from 7.5 to 21.3%. Mean percentage change in weight, which was one of the key secondary outcomes, was 10.5% in the semaglutide group compared with 2% in the placebo group. Additionally, blood pressure, A1C, and aspects of the patient's liver profile all improved with semaglutide. 88% of patients in the semaglutide group maintained a target dose of 2.4 milligrams once weekly until week 72. With regards to adverse events, 86% of patients in the semaglutide group and 80% of patients in the placebo group had some adverse event. 13% in both groups had a serious adverse event. As expected, for those who got semaglutide, the most common side effects were GI in nature, including nausea, diarrhea, constipation, and vomiting. So what were some of the limitations with this trial? Well, the primary outcome, although important, it's not the more typical clinical endpoint that we commonly report on. However, the plan is to report on clinical outcomes with completion of this trial. So what's the take-home point? Well, in patients with MASH and stage 2 or 3 fibrosis, once weekly semaglutide improved liver histologic results. Is this practice changing? Well, Health Canada is currently reviewing semaglutide for the indication of MASH. I think barring some surprise finding when it comes to the clinical outcomes of this trial, this will likely be a game changer for MASH. Well, this was a one and done episode, but before we go, the good stuff. Not to jinx anything, but the Toronto Maple Leafs have made it into the second round of the Stanley Cup playoffs. We will take it. Let's see what happens next. All right, everybody, thanks a lot for listening. Talk to you later. The Rounds Table is hosted online at medicinepods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X.